My name is Dr. Sarwar Chaudhry. I'm a pulmonologist. I'm going to talk about vocal cord dysfunction. Vocal cord dysfunction is not an uncommon problem. It can present with symptoms which are so similar to asthma that many times it is mistaken for asthma, though asthma medication may not help this problem. Patient may have this problem for a while before they actually get diagnosed with vocal cord dysfunction. Before we go further, we need to understand what is vocal cord dysfunction. It is abnormal spasm in the vocal cord which are present in our voice box, and they become tense and then come close together as we're trying to breathe. So the patients, instead of breathing through open vocal cord and normally, they have to breathe through slightly closed or nearly closed vocal cord, and they feel difficulty breathing in. It is a functional disorder. What it means is that there is no organic reason for why people develop it. Some people just have sensitive vocal cord that get so tense and come close together to cause this problem. This is also called inducible laryngeal obstruction, meaning the larynx does close sometime. It is intermittent problem. The most common symptoms that we encounter with vocal cord dysfunction are difficulty breathing air in, wheezing, constriction in the throat, husky voice, losing the voice completely sometime, breathlessness, chest tightness, throat tightness, frequent urge to cough, frequent urge to clear throat, feeling of a lump in the throat, and sometimes breathlessness. As I said, these symptoms may also sound very similar to asthma, and many times it is mistaken for asthma. In terms of how we can diagnose this to clearly separate the symptoms coming from vocal cord dysfunction and some other problems like asthma, in that case, the symptoms can be very difficult to differentiate, and this problem is many times associated with asthma. The other associated problems are reflux disease, in which the acid can come up as a form of food reflux, which irritates your throat more and the vocal cord goes more into spasm. Other disease which coincide or exist together is allergic rhinitis or rhinosinusitis or hay fever, in which case the secretion from the back of the throat falls at the back and make your vocal cords more sensitive, causing those symptoms. A patient who has a severe sleep apnea, they tend to get more symptoms along with the people who are overweight. The risk of having vocal cord dysfunction is much higher in women aged 20 to 40 years. In terms of the diagnosis, it is important to exclude other organic causes like asthma, for which we need to do the breathing test for almost all of those patients. On the breathing test, we can also demonstrate some inspiratory problems on a special maneuver which can help us deciding whether there is a component or strong suspicion of vocal cord dysfunction. The gold standard test of vocal cord dysfunction is a direct observation of the vocal cord that we can do either with laryngoscopy performed by ENT doctors or bronchoscopy done by a pulmonologist. In that case, we ask the persons to make few sounds and observe the movement of the vocal cord. If the diagnosis is confirmed that way, we need to move on to the treatment of vocal cord dysfunction. It is important to understand that this is a condition of unknown cause, and there is no pharmacological or medical therapy for vocal cord dysfunction. The most effective treatment available for vocal cord dysfunction are speech pathology interventions causing breathing exercises, speech exercises which tend to relax your vocal cords, and your symptoms tend to get better with time. Many times these symptoms can get flare up or exacerbated due to an acute viral illness like flu-like illness, bad hay fever or sinus problems, any stress, exercise can make it worse, and bad reflux disease along with many mental health problems like panic attack can make it quite bad. It can sound very alarming to some people, especially who has got inspiratory stridor or a sound while they're breathing in. Luckily, it may sound very terrible, but it is not a life-threatening situation. If our speech pathology exercises are not helping, then we can try some medication to relax the vocal cords. Even if that fails, then there are few experimental treatments, including the injection of Botox into the vocal cord to relax them. That can help, in some people. Can be done in a very specialized centers. People who present with severe vocal cord dysfunction have persistent symptoms of difficulty breathing in, may need a tracheostomy, making a hole in the windpipe to directly breathe through it rather than going through the voice box. And it is rarely needed in such patients of vocal cord dysfunction. As I said, it can be associated with many other diseases, and it is important to manage those conditions effectively too, including asthma. Uncontrolled asthma is associated with the ongoing symptom of vocal cord dysfunction. It is also important to remember that inhaled steroid or any inhaler medication can make vocal cord dysfunction worse. So there's a right balance between the management of asthma and vocal cord dysfunction that is required. And many times it requires multidisciplinary approach to such patients. So if you suffer from vocal cord dysfunction symptoms, you should consult your pulmonologist or physician for further assessment. If you would have any questions, you can access our blog on the link given in our description. If you have not subscribed to our channel yet, please do so we can give you more updates regarding the respiratory health.